Depression. Depression is described as an alteration in brain chemistry, as well as it can also be a response to different situations. So, as an alteration in brain chemistry, sometimes that affects our inhibitory and cholinergic neurotransmitters, our ions such as potassium, sodium, and magnesium, as well as levels of serotonin. So it is often believed that depression is caused by low levels of serotonin. So serotonin is a chemical produced by the nerve cells, and it's also found in the digestive system mostly, and as well as the CNS. So this is thought to be linked to depression. In addition, depression can be a response from healthcare providers and as well as society, and as well as a complication from a pathophysiologic process. So a response to illness. Let's say somebody develops cancer, and although let's say there's not an imbalance in neurotransmitters, a patient can still develop depression secondary to an illness that they're going through. Criteria for diagnosis. So in order to be diagnosed, so you're going to go through this if you take a class in psychiatry or psychology or psychiatric nursing. The reference that they use is the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or DSM-5. So this is a reference guide that is used by the American Psychiatric Association, which presents the diagnostic criteria for different psychiatric illnesses or diagnosis. So for depression specifically, it is said that more than half of the chronically depressed adults have a comorbid personality disorder, and that 1/3 have a comorbid anxiety disorder and or substance abuse disorder. So anyhow, so let's go over or briefly talk about some symptoms of depression. So sometimes depression symptoms can include sleep disturbances, so oversleeping or insomnia. It can be either or both. It can also affect the eating pattern. So sometimes it can cause eating more than usual, or sometimes it can cause a patient to have decreased appetite, therefore eating less than usual. In addition, it can cause decrease in energy, fatigue, decrease in interest in activities, especially activities that the patient used to be very interested in or involved with, as well as decrease in concentration, and at times it can include suicidal ideation. So as you can see, the symptoms are quite general. So there are times, so specifiers, there are times that symptoms can overlap, and not because the patient presents with the symptoms that they're necessarily depressed. Sometimes this may be a symptom of a different psychiatric disorder. So we have to be very careful when it comes to labeling or diagnosing. So we need to be very careful, and we need to make sure that they met all the criteria. And as nurses, we don't diagnose unless we are practicing at an advanced level as a psychiatric nurse practitioner or advanced practice provider. Therapeutic effects of antidepressants. So this should help relieve symptoms in approximately 6 to 8 weeks of therapy. As you notice here, it says 6 to 8 weeks of therapy, and this is a very important patient education piece that we have to let our patients know, because some patients will expect that as soon as they're on those medications that they will start feeling better. Although for some, probably a few days after, they will start feeling a little better. But generally speaking, it takes about 6 to 8 weeks to achieve that therapeutic response wherein the patient feels significantly better. In addition, some therapeutic effects including, hopefully, right, that the patient don't harm themselves. So no harm to self. Indications. So indications for antidepressants include major depression, seasonal affective disorder or SAD, generalized anxiety disorder or GAD, or obsessive compulsive disorder or OCD. This can also be used as an adjunct for pain management as well as smoking cessation, depending on which medication that we are talking about. So again, we have to be very careful, especially signs and symptoms of depression can be very similar to, let's say, anxiety and so on. And in addition, the drugs that we use for depressions are also drugs that are used for other indications such as anxiety, OCD, SAD, and pain management, as well as smoking cessation. So again, it is very important to get a very thorough past medical history of your patient. Precautions and contraindications. So it is very important to assess for concurrent use of varied classes of antidepressant, including herbal remedies such as St. John's wort. So this plant or herbal remedy is basically derived from a plant which is also used for depression over the counter as a supplement. So some people would use it for anxiety, to help them sleep, for menopausal symptoms, and so on. That being said, this can interact with some antidepressants, or sometimes this can actually potentiate the effect of some antidepressants. So we have to be very careful, and we need to make sure that we get that thorough medication history. And if this is a medication that they're on, it is very important to talk to the provider or the treating physician about the supplement so that they can actually give or prescribe the appropriate medication, or maybe give a different recommendation. Maybe stop taking the St. John's wort at this time, or maybe trying to figure out if there's another drug that will not interact with this supplement. In addition, other contraindications or precautions include cardiac or seizure history. So as mentioned in the seizure lecture, some antidepressant can actually affect seizures. So it can decrease the seizure threshold. So when you decrease the seizure threshold, you're actually increasing the risk for seizure activity. So again, very careful when giving antidepressants to patients who have seizures, because it can increase their likelihood of developing seizures. And just like your anti-seizure drugs, antidepressants need to be tapered. This can actually cause some severe complications or adverse reactions if we don't taper these drugs. Nursing actions include assessing for therapeutic and side effects, especially serotonin syndrome. So serotonin syndrome is basically an elevation or excess in serotonin due to SSRIs or sometimes SNRIs. So this causes increase in body temperature. It can also cause agitation, tremors, increased reflexes, sweating. It can cause dilation of the pupils and diarrhea. So these are the things that we need to keep an eye on, because if your patient starts developing the symptoms, we need to start thinking, is the patient developing serotonin syndrome? Again, a very, very scary side effect or adverse effect of these medications. In addition, some other nursing actions include ensuring that the reason for the use of the agent is appropriate, and also ensuring that the patient knows why they're on it. Let's say a patient is prescribed a SSRI, which is often used for depression, and the patient can start questioning, well, why am I on this medication when I don't have depression? Well, maybe the patient has chronic pain. Remember, sometimes these drugs are used for other purposes or indications. So maybe it's for their pain. Sometimes maybe it's for their anxiety, and so on. So we as nurses, we need to know why we're giving the drug, so that also we can educate our patients as to why they are taking those medications. Especially there are going to be patients that are going to be asking you these questions. So you need to be able to tell them why. Why are they taking this medication? What is the indication for this drug? In addition, part of our patient education, we need to educate them about the disorder or their diagnosis. We are not diagnosing, of course, but also once after they're diagnosed, right? If we can give them extra information on how to care for themselves at home, and what are things that they should do or not do, and so on, and anything related to their medication, as well as we need to be that bridge, that facilitator for hopefully counseling, because sometimes these disorders or this diagnosis can be treated with counseling alone, and sometimes pharmacologic treatment in combination with counseling. Statistically, through research, it's shown that counseling is also quite effective, especially when combined with pharmacologic management. There are different classes of antidepressants out in the market. So these are going to be the most common ones that you will see in your practice, or maybe even in the outpatient setting. So these are the classes that you have to know for this class. So one would be your tricyclic antidepressants, or TCAs. TCAs are the first generation antidepressants. So these are not used often anymore as much as SSRIs, because SSRIs have taken over. So SSRIs are the selective serotonin reuptake inhibitors, which we're going to talk about in a little bit. So indications for TCAs or tricyclic antidepressants include major depression, OCD. Back in the day, TCAs were also used for neuropathic pain syndrome and insomnia, but now not so much. I mean, you may still see some providers ordering it, especially if they've been practicing for quite some time, but ideally this shouldn't be used anymore as there's really not enough evidence to their effectiveness for those specific problems. Side effects include orthostatic hypotension due to the alpha-1 blockade. So as you can recall, alpha-1 receptors affect our arteries. So alpha-1, because TCAs can block those receptors, it can cause vasodilation, causing hypotension or low blood pressure. In addition, it can cause sedation and anticholinergic effects such as constipation and urinary retention. Examples of drugs under this class is Elavil or amitriptyline. So I believe I gave you the wrong spelling in your outline, so if you guys don't mind correcting it. So this is spelled amitriptyline, not amitriptyline. So again, the only TCA or tricyclic antidepressant that you have to remember is amitriptyline or Elavil. And please make sure that if your patient is on this medication, we have to educate our patient that overdosing with TCA is quite lethal, especially if they take it with alcohol. So they need to avoid alcohol when they're on this medication because alcohol can increase the risk for overdose. Selective serotonin reuptake inhibitors or SSRIs and serotonin norepinephrine reuptake inhibitor or SNRIs. These medications are second generation antidepressants. So when we say uptake is basically when the neurotransmitter or the chemical messenger is released by a nerve and then taken up by the other nerve. Now reuptake is when the neurotransmitters that are not taken up by the other nerves are taken up again by the same nerve that release them. Indications for these drug classes include major depression, generalized anxiety disorder or GAD, and OCD or obsessive compulsive disorder. Some side effects include the following. So one very important side effect that we have to let our patients know about is sexual dysfunction, especially in males. Now it can happen too in females, but then usually this is more of a big deal for male patients. In addition, another side effect can cause weight gain, although I didn't write it here, but these medications are known to cause some weight gain. Additional side effects include headache, insomnia, or sedation. Although not indicated here, I want you guys to write it down. Contraindication to this medication include known allergy to this drug and use of monoamine oxidase inhibitors or MAOIs in the previous 14 days. Although generally speaking, we need to assess for suicidal tendencies, especially during the early treatment. We have to be very careful, especially with this drug when it comes to suicidal tendencies, because most antidepressants can have that side effect, especially the first couple of weeks that they're on this medication. The drugs that you have to remember under this class include escitalopram or Lexapro, paroxetine or Paxil, fluoxetine or Prozac, and sertraline or Zoloft. Monoamine oxidase inhibitors or MAOIs are basically used mostly for depression that are unresponsive to other agents. So this drug is not usually the first line or the first medication to give a patient with depression or other diagnosis, just because this drug has so many drug and food interactions, and this is quite hepatotoxic or toxic to the liver. So again, this is used when they've tried all the other medications and none of them are effective in treating their depression. Then this would be the last resort medications to treat their depression. But if there are other drugs that they could use, usually the providers will order or prescribe a different drug because this has so many drug and food interactions. Examples of drugs under this class is phenelzine or Nardil. You may notice that this specific drug is also, or drug class, it's also used to treat Parkinson's due to the effect in inhibiting the breakdown of dopamine. That being said, this drug has so many interactions as well as adverse reactions, and so this drug can actually increase the risk for hypertensive crisis. And it is also very important to avoid the intake of caffeine when on this medication. That's the reason why this is usually not the first line when it comes to depression. Atypical agents. So indications for this include depression, and sometimes depending on which drug we are talking about, they can be used for different indications as well. So side effects that we need to keep an eye on: seizures, nervousness or anxiety, as well as insomnia or sedation. In addition, these drugs can cause headaches, dry mouth, and weight changes. Examples of drugs under this atypical agents classification include trazodone or Desirel and bupropion or Wellbutrin. Trazodone, other than being used for depression, this is a non-addictive medication, so it is also used for insomnia as well as chronic pain. Bupropion or Wellbutrin, on the other hand, this is also used for smoking cessation, so this is not only used for depression, but at times you may see patients who are trying to stop smoking on this medication.